flu vaccine. Today I would like to persuade my audience that getting the flu vaccine could not only prevent you from receiving the flu, but also prevent you from getting life-threatening illnesses that can be caused from the flu. Today I would like to talk to you a little bit about the flu, how the flu is spread, and some pros and cons of getting the flu vaccination and who should be vaccinated. Let's think about this for a minute. What if a simple trip to a doctor's office that might take an hour of your day once a year to get a flu vaccination could prevent you, someone you love, or an innocent person with a chronic illness from getting the flu? According to the Center of Disease and Prevention, or CDC, in the flu season of 2017-2018, 45 million people became infected with the flu, 21 million people were hospitalized from flu complications, and 61,000 people actually died from the flu. Today I would like for each of us to think about how getting the flu vaccination could not only prevent us, but also anyone around us from becoming infected with the flu and possibly facing life-threatening illnesses. As a nurse, I have seen firsthand how quickly the flu virus can become deadly. My first year as a nurse, I was working on the med-surg unit and was taking care of a young man who had been admitted with flu complications. I saw quickly how rapidly his condition deteriorated and he suddenly died from flu complications. Not only was he a young, healthy man, but he was a father to several young children. It was a very heartbreaking situation, and we did find out that he had not been vaccinated for the flu. Had he been vaccinated, he could have possibly not got as sick and not have died from flu complications. Today I would like to talk to you about the flu virus, how it is spread, some pros and cons of getting the flu vaccination, and who should actually be vaccinated. As noted in MayoClinic.org, the influenza or flu virus is defined as an infection that invades the respiratory system, often the mouth, nose, and sometimes the lungs. The virus can be spread very easily. Anytime someone infected with the flu virus coughs, sneezes, or even talks, tiny droplets become airborne and can get in the mouth of a person nearby and cause them to be infected with the flu virus if they have not been vaccinated. Also, every time you touch something in a public place, think about the fact that someone could have coughed or sneezed in their hand and then touched the buggy, and then you come along and get the buggy, and if you've not been vaccinated, you then take a chance of contracting the flu. According to an article I read in Live Science, Dr. Alonso, a healthcare researcher, conducted a study which determined that a person touches their mouth 3.6 times in an hour, and they touch objects around them 3.3 times in an hour. So basically, 3.3 or 3.6 times an hour, you've touched your mouth, an object, your mouth, and if someone near you has coughed, sneezed, or touched those areas that you've recently touched, you could become infected with the flu. How often do you wash your hands? As a nurse, I wash my hands all day long when I'm working, and it's a habit when I'm at home. I just wash my hands. But after reading about the research that Dr. Alano done, I realized that no matter how many times I wash my hands, I may wash my hands in a public restroom, come out, touch the door handle. Someone that had the flu may have just touched that door handle. I touched my mouth. I've just possibly infected myself with the flu. So no matter how many times a day you wash your hands, there's no way to keep all the germs washed off your hands. Now let's talk a little bit about some of the pros and cons of getting the flu vaccination. I personally believe the pros outweigh the cons. One of the pros is it can prevent you from getting the flu. According to the Centers for Disease Control and Prevention, or CDC, receiving the flu vaccination is the most effective way to prevent yourself or others from getting the flu. A second pro is that if for some reason you do get the flu, you are likely to have a milder case of the flu than if you had not been vaccinated. A third pro I read about is that if you do receive the flu vaccination, you're less likely to face serious complications that can be caused from the flu and being hospitalized or possibly even death. Some of the cons of getting the flu vaccination include, again, you could still possibly get the flu, because we all need to keep in mind that once you receive the flu vaccination, it takes up to 2 weeks for your body to build an immunity against the flu. So if for some reason you came in contact with somebody with the flu during that 2 weeks of receiving your flu shot, you are at risk for getting the flu. Some people may have a real allergic reaction to the flu vaccine and not be able to think they can't take it. According to the CDC, unless it's a serious illness, then you need to a serious reaction, then you still should get the flu vaccination. Another con about getting the flu vaccination is there is a very rare chance that it could trigger a disease known as Guillain-Barré syndrome. But again, it is very rare that that can happen. Who should be vaccinated? According to vaccines.org, anyone 6 months of age or older should receive the flu vaccine. It is a part of routine vaccination for children, teens, and adults. Another group is people who are at risk for complications from flu, such as pregnant women, the elderly 65 years of age and older, children 5 years of age and younger, especially those 2 years of age and younger, and people with long-term chronic health conditions such as asthma, cancer, and diabetes. Healthcare providers and caregivers should always get the flu vaccination, because think about it. You're in contact with someone that already has a chronic illness, and if you don't get the flu vaccination and cause them to get the flu, they could easily deteriorate rapidly. Now let's recap. The flu is a respiratory infection that often attacks the mouth, nose, and sometimes the lungs. The best way to prevent yourself or someone you love or anyone around you from getting the flu is to be vaccinated. There are several pros and cons concerning the flu vaccination. Pros would be it can prevent you from getting the flu, in some cases cause you to have a milder case of the flu, and keep you from being hospitalized or possibly dying from flu complications. Some of the cons would be you could still get the flu, you may be allergic to the flu vaccination, or that very rare chance that you could trigger Guillain-Barré syndrome. Lastly, we discussed who should get the flu vaccine. Let's think about this for a minute. If you could spend 1 hour of your day once a year to go to the doctor and receive a flu vaccination, wouldn't it be worth it to you knowing that you've done your part to prevent yourself, your loved ones, small babies, children, elderly, people that you may come in contact from becoming infected with the flu that could lead to serious complications and in some cases death? Get your flu shot.